indoor-outdoor nighttime shopping event. So that seems cool. Listen, it's been a great show. Thank you so much to Chelsea Stewart for calling in today and joining me on the Raw Report. I appreciate you guys, of course, inside of our YouTube chat, and those of you who are listening everywhere else. You already know who's coming up next, though. It is
KBLA 1580 Santa Monica.
Good morning, and thank you for joining us on this Thursday, November 16th. I'm Mike Moore. Now here's the latest from the Black Information Network. President Biden says his meetings Wednesday with Chinese President Xi were some of the most constructive and productive discussions the pair have had. Biden said in a post on X that the two built on the groundwork laid over the past several months of diplomacy and that important progress was made. 2 Northern Indiana judges are among 5 nominated by President Biden for federal judgeships. St. Joseph Superior Court Judge Crystal Briscoe and Elkhart County Superior Court Judge Gretchen Lund are now under consideration. They need the approval of the U.S. Senate and would be tenured for the rest of their lives. Briscoe would become the first black woman to serve on a U.S. District Court in the Northern District of Indiana. And that's the latest. I'm Mike Moore. From your 24/7 news source, the Black Information Network and BINnews.com.
Don't let a traffic accident ruin your day. Visit fixautousa.com to find the nearest Fix Auto location. Their highly trained and certified technicians will have you back on the road in no time. You have a choice on who fixes your vehicle. Tell your insurance agent that you want to go to Fix Auto.
This is the KBLA Sports Minute with Ray Richardson.
A dismal night for the Lakers at Crypto.com. They lose at home by 15 to the Sacramento Kings. The Lakers committed 23 turnovers. 11 of those turnovers belong to LeBron and Anthony Davis. Get ready to hear some talk in the streets about the Lakers making a trade. The Lakers reportedly are one of 4 teams interested in swinging a deal for Chicago Bulls guard Zach LaVine. The former UCLA star is not happy in Chicago. The Bulls are off to a 4-8 start. We'll keep you updated on this development. Golden State's Draymond Green was suspended for the 5th time in his career. This time, the NBA sat him down for 5 games for putting Minnesota center Rudy Gobert in a chokehold Tuesday night. The suspension will cost Green $1.36 million. No debates, no speculation, just the info you need. That's your KBLA Sports Minute. I'm Ray Richardson. More news, opinions, and conversation when we come forward on KBLA Talk 1580.
KBLA Talk 1580 invites you to join us in celebrating the season of giving by being part of the solution. As we enjoy great food, family, warmth, and well wishes in whatever our festive tradition may be, we share the beauty of the season by reaching out to the less fortunate. Please help us to help others with the KBLA Cover the Houseless Cozy Community Coat and Blanket Drive. All you have to do is drop off new or clean, gently used winter coats and blankets in the KBLA lobby during business hours. Now through December 20th, all of the coats and blankets will be donated to unsheltered individuals and families experiencing houselessness. Simply bring your donation to 4434 Crenshaw Boulevard in Los Angeles, near Vernon Avenue, from 9 a.m. to 5 p.m. weekdays. That's 4434 Crenshaw in historic Leimert Park. During the holidays and every day, let's remember, we keep us safe. We keep us warm. We are the safety net. And together, we can cover the unsheltered. Get caught up in the spirit of the season, the spirit of love. Make a difference with your friends at KBLA Talk 1580.
First things first.
Things first, it's the DU General, Money B. I'ma put you up on the schedule, 6 to 9, 8 weekdays, not 2 and 7. Let's go. We got a lot to talk about, so much to pedal through. Unapologetically progressive. Tune to KBLA 1580 to get the mess. We're your ancestors' favorite radio station. First black on talk radio, left side of the nation. Me and Dominique DePrima go way back. Tag Smiley making sure the station stays black. Discussing all the issues in our community. We're hosted black and brown and others find unity. So let's talk about it. Maybe we can improve it. Digital underground, always down with the movement. So we tune in. The first things first with the queen of Black Talk Radio, Dominique DePrima. Go sis. First things first.
KBLA Talk 1580. Good morning. Good morning. God bless. I'm Dominique DePrima. The show is called First Things First. My first thing every day, giving thanks, giving praises, and asking for blessings from God, asking for the blessings of the ancestors and the elders, and getting it started. What are we starting? Well, hour one, we usually do Left Coast. What's going on in California all along this Pacific Ocean kind of coast? What's happening in your neighborhood? All of that. Hour two, we go national, international, and beyond. And in the third hour, we do a deep dive with a person or persons of interest. It's been kind of serious around everywhere in the whole wide world lately. We have a little levity today in a deep kind of way, as comedian Ray Grady will be joining me in studio. So that will be fun. You're invited to, participate in every hour. 800-920-1580. 800-920-1580 is your ticket into some reciprocity, some conversation, some engagement. I hope fellowship. 800-920-1580. Yeah, I'm talking to you. Excited to have a really distinguished guest this morning joining me, hour one. He is currently the county health officer at the Los Angeles Department of Public Health. He serves as the department's medical expert regarding public health matters, provides guidance and leadership across the department. Dr. Muntu Davis, good morning.
Good morning, Dominique. How are you?
Good. It's great to talk to you again. It's been a while, and I know a lot has happened in between.
Yeah, it has.
So, we have so many crises right now, locally, nationally, internationally. I think a lot of us have sort of forgotten all about, the public health, the daily updates, the big picture and the small picture of what's going on here locally. And I believe that's understandable, but it's your job to keep us in the loop. So let's do that. I mean, when we talk about this massive crisis of 2020, the lockdowns, the coronavirus onset, how do you compare where we are now with that crisis to where we were 3 years ago? Well, really 4, because it's almost 2024, right?
Yeah, it seems like it's gone by fast, but it also seems like it was just yesterday. When we first started this, it was really something that was new, something that spread very quickly across the world and, caused a lot of heartache and headache just in relationship to the amount of infections, the amount of hospitalizations and deaths that it caused. And even to this day, it's still circulating. But we're in a very different place than when we first started. When we first started, we didn't have tests. It took us a while to get tests at the level that we have right now, where we have over-the-counter tests that people can go pick up, take it home, and widespread tests even within our healthcare system. When we first started, we really could only test those who were in the hospital. And so we really didn't have a good sense of how widespread it was. We also didn't have treatments for those who were sick to try to prevent them from dying and even prevent them from getting into the hospital. And we definitely did not have vaccinations. And so we're in a very different place than where we were before. However, as many winter respiratory viruses, this one keeps changing. And unlike flu, this one has continued to spread throughout this whole time at varying levels and causing different amounts of illness, and serious illness in people. But still is, one of the viruses that can cause more deaths than flu, and has continued to do that.
Really, still causing more people to die than the regular garden variety flu.
Oh, yeah, definitely. I mean, and unlike flu, you can also have what's called long COVID, meaning, months after having the illness, you still have symptoms or they recur. And that is something that's not something we typically see with our respiratory viruses.
Well, I remember very well during the most crucial periods of, coronavirus, and although the precautions we took, that there was always a warning about a summer surge and a winter spread because of the holiday gatherings, because we're more vulnerable, I guess, to getting sick during the winter months when there's also flu and other taxing things on our immune system. Are we looking at that situation again in winter of 2023/24?
Yeah, I think we are looking at that. The question that many of us have is it going to be as bad as it was before? Are we going to see as many infections or hospitalizations or deaths as we have before? And we still have seen, similar patterns in terms of going up in the summer. Anytime we're starting to be active, travel a lot more, gather more indoors, that pattern is still there. I think just over time, given the amount of vaccinations, the amount of people that have been infected, some multiple times, we're just not seeing the same level or same sharp increases that we've seen in the past, or as high as we've seen in the past. But again, it keeps changing, so we're just hoping that we don't get a new strain or a new type of virus that would evade what we get in terms of prior infection or immunity.
I mean, I think there's a level of coronavirus, COVID. I'm sure you know this. Fatigue. Like, people don't want to hear about it. They don't want to talk about it. I don't see people. There's a few diehards that mask up, but I don't see anywhere near the level of masking that I've seen in the past. Traveling recently, that on an airplane, that's one place you're definitely going to see me in a mask, because I don't want to be, if I'm going to be on a plane with you for multiple hours, I don't want to breathe everything you're breathing. But I think there were hardly any people recently I've traveled, there were very few in the airport or on the planes that are masked up. Is that concerning to you, or, given where we are, it's normal?
I think given where we are, I can understand why people don't have the same fear or concern as they've had before. However,
sounds like
a recommendation.
Okay. We lost you for a moment, Doctor.
Yeah, I think I'm having the same issue. I'm losing you every now and then for a moment, and I'm on a landline as well. But
Okay. Well, we'll see if we can fix that during news, traffic, and sports. Yeah, go ahead. I'm sorry. Go ahead.
We don't have the same high level of infection that we've seen in the past, and so I can understand why people may feel like, well, it's not as much of a threat, but it has continued to circulate, and there are still situations in which make it riskier for you to be infected. And so we still have that recommendation, a strong recommendation, that people wear it on public transportation and transportation hubs, airports, et cetera. Or if they're in crowded indoor situations where, it's not very good ventilation. And so I do understand it, but there still is that risk.
So I know, people may not want to hear it, but what are the current recommendations and what are the current mandates? I've been hearing that, some municipalities, some regions are requiring masking again or considering that. Where are we at right now in LA County?
Well, right now, again, as I mentioned, we have those strong recommendations for everybody to wear it on public transit.
Okay.
Where,
yeah, we just lost you again. Dr. Muntu Davis is our guest. He's County Health Officer for the LA County Department of Health. Yes, we heard you say you recommend it on public transportation, and we'll get the full guidelines and not just recommendations. If there are mandates coming or currently in place, want to hear about those, all that straight ahead on KBLA Talk 1580.
More of First Things First with Dominique DePrima when we come forward.
To some, this might sound like a typical family dog. But at Dog Chow, we know that for a veteran suffering from PTSD, this could be the sound of life-saving therapy.
Thanks, Betty.
That's why we've made it our mission to connect every military hero in need with a canine hero of their own. To learn about the simple ways you can help Dog Chow in our mission, visit dogchow.com/veterans.
Environmental justice, pollution, and climate. In Los Angeles and across America, people of color are suffering and dying from disproportionate health impacts on a planet that has less than 10 years to prevent irreversible damage. Heat illnesses, respiratory illnesses, water-related illnesses, food system impacts, insect-related diseases, black maternal health, and mental health effects. As the impacts of climate change mount, millions of vulnerable people, our people, are going to bear the brunt of these extreme environmental events, which will likely lead to forced displacement, loss of cultural identity, and other related risks. These realities are as real as rain. Stay tuned to KBLA Talk 1580 for more details about the most progressive multimedia and live events campaign any black media outlet has ever undertaken to combat the climate catastrophe. Experts, events, empowerment. It's all on the way from unapologetically progressive KBLA Talk 1580. We don't black down. We level up.
Level up, 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 level up.
We've got a lot to talk about.
Hi, I'm Zoe Williams, a.k.a. the Voice of Reason, encouraging you to join me weekdays from 7 to 9 p.m. for the world's most intriguing relationship radio roundtable. Every night, I facilitate and encourage our loyal listeners to participate in the most engaging relationship discussions you'll hear anywhere. So make it a point to rendezvous with me, Zoe Williams, the Voice of Reason, Monday through Friday, 7 to 9 p.m. Pacific Standard Time. Trust me, your relationships will never be the same. The VOR is on fire tonight.
Unapologetically progressive. KBLA Talk 1580. We've got your black.
She's so smooth, so... I'm interrupting my own shower to remind you to treat your skin like the queen she is with Olay Hyaluronic Body Wash, packed with Olay's highest level of vitamin B3 complex. It's so moisturizing that it will give you visibly smoother, head-turning skin in just 14 days. People wondering, how'd she get so smooth? Olay Hyaluronic Body Wash. Also, try Olay Hyaluronic Body Lotion.
Your ancestors' favorite radio station, and your favorite morning show host. Let's get back to Dominique DePrima right now.
Right now, talking with Dr. Muntu Davis, County Health Officer for the Department of Health, the LA County Department of Health. I know, for example, Dr. Davis, that the Bay Area is back to mandating masks in certain settings, right, for healthcare workers and others. You've said strong suggestion to wear one on public transportation, but are we in LA County back to mandates, and do you see that on the horizon if we're not?
If we were to go to, so we've been tracking, and the CDC tracks the hospital admission level for a jurisdiction, per 100,000 people, which is really a measure of how severe of an illness.
Okay, we're having an issue. The phone is going in and out for some reason. I'm not sure what's going on here.
Yeah, it's doing that on my end as well.
Okay, well, we're going to try again and see if we can get that fixed. We're talking with Dr. Muntu Davis, and I do want to cover, talk about coronavirus, where we are also with the vaccines, because I know some institutions, I'll call them, are considering, or being asked to consider rehiring people that were laid off because they refused to get those vaccines, where we are with that. But I also want to talk about some of the other aspects of health, because I feel like not unique to LA County, probably this is something people are experiencing worldwide. We are under a tremendous amount of stress. I feel like I'm saying that year after year, but 2023 has been a lot. And even with the closure of the 10 freeway, which now, by the way, we're hearing may be reopened to traffic in under a week, that they'll be working on it and building it while you're able to drive on it, which is great news because people are already getting, irritated and frustrated. But, all of these things to me are stress factors. So I want to talk about that too. We've got Dr. Muntu Davis back on the phone. So where are we with possible mandates or existing ones, Dr. Davis?
So right now we have within healthcare for those who don't get vaccinated against flu and as well as COVID, they are required to wear a mask when interacting with patients or providing patient care or in patient care areas. If we were to get to a level of medium or high in terms of our hospitalizations, and this is a measure that is posted and tracked by the CDC. It's a measure that tells us how bad is the infection causing in terms of severe illness. If we got to medium, we'd start to look and see, do we need to require masking of everybody in healthcare? But definitely if we got to the level of high, we would require masking of both workers and visitors inside of a healthcare setting.
So it could be considered. It felt like when I've heard the governor talking about these mandates, and not just Governor Gavin Newsom, but elected officials in other states too. It feels like there's a hesitance to go back to any kind of real full-scale lockdown. It became very politically divisive and economically impactful. And we've seen these data coming out of Sweden that say, well, they didn't lock down, and they over time did not have demonstrably different outcomes than we did, and they didn't have the economic impact, even though they took a completely different route to protect the public.
Yeah, there are different systems and have different protections in place. I would say at this point, given the fact that we've had testing widely available, vaccinations widely available, treatment widely available, we don't at the moment see any reason we would have to go back to the shutdowns that we had before. The only thing that might be different just in terms of thinking about, masking would be, again, do we have something that is really just running rampant again at the same level that we saw before? And does that mean that we go back to masking in all places? But right now we're very focused in on trying to prevent illness in our highest risk populations and thinking about those settings where it's more likely to be transmitted. And healthcare is one of those settings.
And apparently we've had our first death from the flu this season, right?
Yes.
So talk to me about what happened and what that means for LA County this winter and our well-being.
Well, that just lets people know that flu is showing up. It is causing serious illness as it has in the past. And this is about the time that we would start to see all of our respiratory viruses, our winter respiratory viruses, start to increase. We've already started to see respiratory syncytial virus, or RSV, which causes, cold and flu-like symptoms and can be severe illness and death in those who are older than 65, and those who are very young. That has already gone up. So now we're starting to see flu go up, and I expect that as we get through the holidays, we'll start to see COVID go up as well. So it really is just a sign to say that, we may be starting that winter surge, and take your precautions now. We don't want that traveling with us and taking that to the parties that we go to and the gatherings that we go to. So just be as safe as possible and make sure you get up to date on all of your vaccinations.
It is gathering the season, and that person who passed was elderly and did have underlying health conditions. So I don't want people to just start automatically freaking out. But it is gathering season, right? It's back to Thanksgiving, Christmas, Kwanzaa, Hanukkah, all the things that people get together for.
Yeah, exactly. And most of these things we're going to do indoors. We're going to be close, laughing, talking. And I'm not saying you should be afraid of that, but we can do a lot beforehand to make sure that we reduce the risk that we get infected and take that there.
Yeah, explain RSV a little bit. We hear it thrown around so much, and it's like, ooh, you might die of RSV, like all these commercials. But that's not really new, right? And so explain why it's getting so much play in the media right now.
Well, there are two reasons. One, we did see, we had one winter where we had all three of them, influenza, RSV, and COVID being seen at high levels at the same time. Each of them caused hospitalizations, and each of them caused deaths. But we do have a vaccine, for those who are elderly, for RSV now. And so, we are making sure that people are aware of that and, go get that protection, if they are 60 or older, as well as for, women who are pregnant and then the treatment for infants as well. So the idea is to try to reduce as much of the risk of these viruses, and we have tools to try to do that. So we want to make sure people are aware when they're transmitting and know what to do to try to prevent, getting infected or from getting hospitalized or dying from infection.
And what is the latest on the coronavirus vaccines? I know there's been reluctance on the part of folks to take boosters. I am one of those people that's not ready to take a coronavirus vaccine every year. It's just not something I want to do. Although, I did get vaccinated. But what's the latest guidance? What's considered fully vaccinated? And what are you asking folks to do? What's your ideal scenario?
Well, the CDC has recommended that everyone 6 months and older get the updated 2023-2024 formula of the COVID vaccine. So this is akin to flu, where you look at what's the worst of the worst that circulated before, and you try to match it to that, anticipating that that's what you're going to see circulating, in the wintertime. And so that's what they did. Manufacturers created or changed the formulation of the vaccine to match really the family of the viruses that are circulating now. So the previous vaccine is not as well matched. And so the updated vaccine is, for this year, the 2023-2024 vaccine is what you need to be up to date.
So regardless
so it doesn't matter
of
what boosters you got before.
Right. Okay.
Yeah, that's serious. You got to get the 2023-2024 formula in order to be up to date.
So that's clear. No matter whether you had, Pfizer, Johnson & Johnson, whatever you got, to be considered fully vaccinated at this point, you need the latest formula. Is that, you'll forgive me for being skeptical, but is that what we're going to be hearing every year? Like now you have to have the 24-25, the 25-26? Because I understand that the uptake, numbers are pretty low and as far as people doing it. And I just think that, it's maybe that somewhat of that fatigue mixed with the skepticism, some people have around taking an annual shot for something like flu or COVID.
Yeah, I will that be what we see? That's a possibility. I can't predict that, but what I do know is that the virus keeps changing. Mm-hmm. And just like flu, if flu gets matched to what was previously circulating in the Southern Hemisphere, which had their season before we do. And so we could see that if the virus continues to change over time. And what I would say to people in terms of vaccinations, I mean, in life, we're always trying to have advantages, right? Protecting ourselves from different things and just to have something that makes it better for us. And so that's what these vaccines, the vaccine is right now. It's really about, if you were to get infected, can we keep you out of the hospital? Can we keep you from dying from that infection? So, is it going to be a mild illness versus a severe illness? You're in the hospital. And so that's the advantage that we want people to take, have that protection from that severe outcome, because it is continuing to circulate. And so that's what the recommendations are, and that's what we hope that people will abide by.
As per, we've got a minute here before news, traffic, and sports, and then I want to talk to you about, impacts on jobs and also some other health factors we're facing in Southern California that may be going on in every city in the world right now. I don't know. But the same recommendations we saw during the lockdown period, that it's more urgent for elders to get these updated shots?
Yeah, that's definitely the case, and for people with underlying health conditions that, may make it more likely that they're going to get a severe illness. That hasn't changed. But I would say to everybody else, you still want to do things to protect yourself because, we are always in contact with people. We don't know who has high risk factors. And so we want to protect each other in addition to our family and friends as we go about our lives.
Don't want to be an accidental killer. We're talking with Dr. Muntu Davis. And we're talking about your health. He is the county health officer for the LA County Department of Health. I'm Dominique DePrima, and you're listening to KBLA Talk 1580.
She's reclaiming her time on KBLA Talk 1580. More First Things First with Dominique DePrima when we come forward.
Good morning. I'm Mike Moore. Here's the latest from the Black Information Network. Former Minneapolis police officer Derek Chauvin is once again trying to overturn his conviction in the murder of African-American George Floyd. Chauvin filed a motion earlier this week claiming he never would have pled guilty if he knew about the theories of a forensic pathologist from Kansas. That pathologist does not believe Chauvin caused Floyd's death in 2020 when he pinned his neck to the ground for over 9 minutes. Chauvin is now requesting a new trial. The NFL Cleveland Browns say quarterback Deshaun Watson will be out for the remainder of the season. This comes after the African-American quarterback suffered a high ankle sprain and a displaced fracture to the shoulder and requires surgery. It happened during Sunday's win against the Baltimore Ravens. And that's the latest. I'm Mike Moore from your 24/7 news source, the Black Information Network and BINnews.com.
Don't let a traffic accident ruin your day. Visit fixautousa.com to find the nearest Fix Auto location. Their highly trained and certified technicians will have you back on the road in no time. You have a choice on who fixes your vehicle. Tell your insurance agent that you want to go to Fix Auto.
This is the KBLA Sports Minute with Ray Richardson.
A dismal night for the Lakers at Crypto.com. They lose at home by 15 to the Sacramento Kings. The Lakers committed 23 turnovers. 11 of those turnovers belong to LeBron and Anthony Davis. Get ready to hear some talk in the streets about the Lakers making a trade. The Lakers reportedly are one of 4 teams interested in swinging a deal for Chicago Bulls guard Zach LaVine. The former UCLA star is not happy in Chicago. The Bulls are off to a 4-8 start. We'll keep you updated on this development. Golden State's Draymond Green was suspended for the 5th time in his career. This time, the NBA sat him down for 5 games for putting Minnesota center Rudy Gobert in a chokehold Tuesday night. The suspension will cost Green $1.36 million. No debates, no speculation, just the info you need. That's your KBLA Sports Minute. I'm Ray Richardson. More news, opinions, and conversation when we come forward on KBLA Talk 1580.
Beloved Entertainment presents Sweet Spot Live with Angelique Francis, host of KBLA's Living in the Sweet Spot at the beautiful Miracle Theater, 226 South Market Street in Inglewood, Sunday, November 19th at 6 p.m. Join me, Tavis Smiley, and KBLA Talk 1580 for real short stories told live on stage by our own storytellers, straight from the neighborhood, celebrating our unique culture, our strengths, our courage, our faith, and, of course, our fire. Come walk with us through the neighborhoods, sit at our kitchen tables, even run with us down our dark alleys if you dare. But just know that in the sweet spot, there is love and laughter, joy and pain, secrets never told. Again, that's Sweet Spot Live with Angelique Francis, Sunday, November 19th at the Miracle Theater, 226 South Market Street in Inglewood at 6 p.m. Tickets available at sweetspotlive.eventbrite.com. That's sweetspotlive.eventbrite.com. Sweet Spot Live, we've got a lot to talk about.
KBLA Talk 1580. We've got a lot to talk about.
KBLA Talk 1580 believes in community empowerment through the arts. Tia Chucha Central Cultural is on a mission to transform community in the Northeast San Fernando Valley and beyond through ancestral knowledge, the arts, literacy, and creative engagement. The Northeast San Fernando Valley has a population of about 500,000, the size of the city of Oakland, yet it has no bookstores, art galleries, or full-fledged cultural spaces until Tia Chuchas opened its doors in 2001. Founded by renowned poet and activist Luis Rodriguez, the Achuchas Cultural Center provides a year-round free or low-cost arts and literacy bilingual intergenerational programming in mural painting, music, dance, writing, visual arts, healing art sessions, and healing talking circles. Activities also include Mexica, Aztec dance, indigenous cosmology, philosophy, and 2 weekly open mic nights, one in Spanish, the other in English. In addition, they host author readings, film screenings, and art exhibits. To express yourself, heal yourself, attend an event, or volunteer, please visit www.tiachucha.org. That's TIACHUCHA.org. This is a community call to action from KBLA Talk 1580.
This week at Target, you'll find different early Black Friday deals. Get fun deals on the latest tech, toys, and video games, plus smart deals on small appliances, floor care, and so much more. At Target, you'll discover different early Black Friday deals each week. And get what you need for the holidays fast with free drive up or score free shipping when you spend $35 or use your red card at Target.com. Get low prices and early Black Friday deals only at Target. Exclusions apply.
Thinking about hosting a podcast and don't know where to start? Morris Media Studios has you covered. We're a professional podcast and voiceover studio located in Leimert Park. We specialize in recording and live streaming audio and video podcasts. Let us help you set up, record, and distribute your podcast. Hosting a podcast is a great way to bring awareness to your business, product, or good cause. For more info, visit morrismediastudios.com or give us a call at 323-815-4204.
Thanks for waking up with Dominique DePrima on KBLA Talk 1580.
And it's a LA thing. That's what we do, hour one today. We're blessed to have the county health officer from the LA County Department of Health, because there are so many issues going on. And even though we might be focused elsewhere, it's important to stay abreast of all of them. So I've heard employees at LAUSD and other, even though I know that's not, directly under county, but other organizations talking about whether or not people should be able to get their jobs back if they were, if they lost their job due to not wanting to get the coronavirus vaccine. And it's a two-part question. Number one, do you see that happening? And number two, are there any regrets about the way that we handled the outbreak? And I say that because it feels like, from what I'm reading, that coronavirus might be the first of many pandemics that we have to deal with as the climate changes and various different diseases become widespread.
There are a couple of questions in there. So, one, I don't know that there are any places that require vaccination as part of, at least for COVID, as part of a job requirement. I think it was very different at that time. Now. But it was very different at that time. We were really employers trying to protect their workforce, You're going to be back here, you're going to be doing your job, but we want you to be protected as possible. I think, how things were handled, I think we have to look at how our society is structured and how we do things in general. It's terrible to see that people who got sick didn't have sick leave. It was terrible to see that a lot of people didn't have the ability to work from home if that's what was needed.
Right.
That's the nature of our society. But I think we have to look at, how we operate. Are we in a position that we can help out if something like this were to happen again? Would we do it the same? I'm not sure. But I can say that, we learned a lot in terms of what happened. We learned a lot in terms of what supports were needed. And the question is how do we put ourselves in place to either not have to do that or be able to do that more quickly than we did in the past?
Yeah, and I mean, even if you listen to KBLA, there's a promo that plays that talks, because we're doing this massive initiative around the climate emergency. And it's a lot of doom and gloom, and we read a lot of that in the papers about, hear it on TV, about how as the temperature climbs on the planet, and we will see more bacteria proliferating, more different kinds of maybe funguses and viruses that can get to the point of a COVID. Does that keep you up at night? Do you feel like we're ready for that challenge? And is there something we ought to be doing or know as the public to address these changes?
Well, it's interesting to watch how things are changing, both in the timing of seasonings, both in what insects we start to see, mosquitoes, et cetera. And so, we have to really pay attention to what's happening and know that our lives are going to need to change in order to reduce the risk for a number of different things. And so it really is, again, how we sort of work together, how we can adjust, and are we willing to change to do what's needed to protect each other and ourselves.
And so coronavirus is now an endemic, right? It's that means it's going to be around all the time at a certain level. That's something confusing. Pandemic, epidemic, endemic. Where are we?
It's still a pandemic.
Really?
We're not at the endemic stage. Yeah. Pandemic is widespread. Multiple countries, continues to go up and down. Endemic may be more localized. The timing may be more specific, but we're not quite there yet. We may get there, but at this point, we're still at a pandemic and still having things go up and down. We'll see what this winter looks like, across the world as well. But that's where we are right now. It's still a pandemic.
And let me talk about flu shots a little bit, because I know that's something, even though I guess flu is endemic, it's confusing again because it does seem to be everywhere in the world and pretty widespread, which is why one of the reasons why people were saying, well, COVID is just another flu. Isn't that like, I ever since I was a kid, we've always had flu, and isn't getting sick and getting over it and building up your immunity, isn't that just part of being a human organism?
It is, but for certain things, when they keep changing, the body may not recognize it as well. And for flu, it's an epidemic. We know that it shows up, at a particular point in time, the year within the community. So that's an epidemic for that period of time, the winter, period of fall and winter. But yes, the body can, in many instances, learn to protect itself from things. But when they keep changing, the body also has to learn and adapt. And that's a lot of what our vaccines try to help do, to get us prepared for something we haven't seen, at the same level that we have in the past.
Because taking a flu vaccine every season is still recommended. I know you guys, I'm always seeing the ads, and they're everywhere. You can get it, at a local clinic. You can get it at your drugstore. That taking that every season does not reduce the body's ability to fight off flu and other things on its own.
No, it actually does the opposite. It actually improves the ability to fight it. This is, it's like exposing yourself to the infection without the effects of an infection, or without being infected.
Without the full effects,
Without the full effect,
yeah.
So getting the vaccine is saying, hey, I'm going to give you a taste of what this could look like, and so you recognize it, but it's not going to be the infection. Mm-hmm. And so that's what vaccines, typically do, especially when they're not live virus vaccines.
Explain what that is. I took yellow fever to go to Africa, and that was definitely live.
Yeah. So for some bugs, I'll just call them in general, we have what they call attenuated or weakened strain of that particular virus or bacteria that we then inject to have our bodies, understand and recognize it if we were to see it. And usually what we'd see is something that's going to cause worse illness, but this is very weak. So it just has the body recognize it. You may have some symptoms, whether it's a fever or chills or some body aches, which are typical post-vaccination. That's just the body working to do what it does. But that's what it is for those. It's a weakened version of whatever it is, and we inject that into the body so the body recognizes it.
As opposed to like the coronavirus, COVID vaccines, which are not considered live, right?
No, they are not. They're not at all. So you can't get COVID from the vaccine.
Right.
You can't get influenza from the vaccine.
Yeah, but you get something, because I felt like so bad after I had them both times. So I guess it just depends on your body, how you react to it.
Yeah, and everybody can be a little bit different, but post-vaccination side effects are common. For many people, some may feel a little bit stronger than others, but in either case, you're not getting the effects of the infection.
I mean, I feel like now in hindsight, it's mostly hindsight, we've gotten to a point on social media where, somebody breaks their leg and it's because they took the vaccination. I mean, it's like every single thing. Oh, every sudden death, every youth death, the rumor mill starts, oh, that was because of the jab. A person can be 90 and have a skiing accident now, and they're going to say it's because they took COVID. How do you respond to that, especially people who are having any kind of like a heart attack or anything like that?
Well, many of these things are studied. I mean, very widely, lots of data that goes in for reports of adverse effects, and lots of analysis of that data. And for many of these things, we may see what's called a signal. It says, hey, look at this. This may be an issue. Look closer at it. And for the time that we've had these vaccines, we know that the infection is worse than, the side effects of the vaccine, and that for many of these cases, you're going to have worse outcomes with the infection than you will with any, post-vaccination reaction. So, the nation looks at this very closely and regularly analyzes and publishes its findings if there are any to publish.
And when you talk about this 2023-2024 formula, the latest booster, which you said earlier, you're not considered fully vaccinated and fully up to date on your shots if you haven't done it. Where should people access it?
Well, let me clarify. So what's out now is not a booster.
Okay.
It's a different formulation. And a booster is when you get the same vaccine, the same formulation, in order to boost your immunity, reboost your immunity again. So this one is not considered a booster. You can get it widespread in terms of at your pharmacies, at your doctor's offices. We have our public health clinics as well. And, really people can go to our website at ph.lacounty.gov and look up where to get a vaccine, close to you. We also have a number of mobile clinics that are out as well, but searching the website for what's close to you, putting in your zip code or your address, definitely will get you the different options that are available for you.
PH for Public Health, ph.lacounty.gov. Continuing our conversation with Dr. Muntu Davis when we come forward on KBLA Talk 1580.
The station you turn to when you've had it up to gear with cultural incompetence. KBLA Talk 1580. KBLA Talk 1580. We've got a lot to talk about.
Hi, Maisha Cairo here, KBLA, live at Chase Bank on Crenshaw and Vernon for the In This Together tour with female business owners, a day of empowerment, community panels, and best of all, tips on building business from marketing to capital. I was able to speak with Kate Luzio, former banking executive and now owner of Luminary, who partnered with Chase for this tour. She makes it her business to build community for business owners.
Yeah, so I was a banker for 20 years before I decided to become an entrepreneur. 7 of those years were actually at JP Morgan Chase. One of the biggest things that I had going into my entrepreneurial journey was a big background in banking.
So what advice are you giving business owners looking for financial backing today?
So Chase brings in so much knowledge and the opportunity to understand what financial tools are out there for business owners to build, grow, and scale their business. A lot of business owners will say, well, I need to get a loan immediately. Well, you wouldn't just lend money to your friend if you didn't know why they needed it. I tell every business owner, you need a business plan, you need financial projections, you need a banker. Because you have to start building a relationship with a banker so that they get comfortable with how you're going to build that business and so that they can eventually support you in different ways.
Makes sense. So visit the Chase Community Center on Crenshaw and Vernon. Meet a banker today. Tell them about your business. I'm Aisha Cairo in the community for KBLA with JP Morgan Chase.
This open enrollment season, LA Care Covered is offering health plans starting at $0 a month. Each plan provides benefits including $0 preventive services, 24/7 telehealth services, around-the-clock nurse advice lines, walk-in minute clinics, and more. Shop and compare premium silver plans with $0 deductibles to help meet your health goals. Ready to shop? Visit us online at lacarecovered.org for a commitment-free instant quote or speak with us directly at 855-222-4239. LA Care Covered, your affordable path to wellness.
Beloved Entertainment presents Sweet Spot Live with me, Angelique Francis, at the beautiful Miracle Theater at 226 South Market Street in Inglewood on Sunday, November 19th at 6 p.m. Join me with KBLA for short stories told live on stage with us, by us. Yes, our own storytellers straight from the neighborhood. Colorful and provocative live storytelling event celebrating our unique culture, our strength, our courage, our faith, and yes, our fire. We invite you to walk with us through the neighborhood, even run with us down our dark alleys if you dare. Just around the corner, there is laughter, unspeakable pain, secrets never told. But don't worry. The door is unlocked and we're going to leave the porch light on. That's Sunday, November 19th at the Miracle Theater, 226 Market Street in Inglewood, 6 p.m. Yes, it is all happening right here in the Sweet Spot. Tickets available, sweetspotlive.eventbrite.com, sweetspotlive.eventbrite.com. We got a lot to talk about.
My ride smells just right, just right, just right, just right.
Y'all gotta try that Febreze car.
Just right, just right, just right, just right. La 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 la. With up to 40 days of consistency, all over Febreze car clips right on your vent. You know my car's my happy place. Keep that smile on my face when it smells just right, just right, just right. Breathe happy Febreze. La 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 la.
At KBLA Talk 1580, we do more than just talk.
You got a big mouth.
Hello, Joe, you're up. Welcome. We're unapologetically progressive, and we don't black down.
And I want to thank you so much, Dr. Muntu Davis, for spending the hour with us. He's the county officer of the LA County Department of Health. And you have a lot of things in your portfolio as far as keeping us safe. Looking at the website that you suggested we check if folks want to get vaccinations, ph.lacounty.gov. And there's a whole thing about lead and, lead poisoning in children. I see something I've read a lot about is the outcomes are terrible, from learning loss to violent behavior to all kinds of disabilities that can come from lead in drinking water. Is this a big problem in LA County still?
It can be. We still are looking at houses that were built in the 60s and before, especially before 1978, which before that time there was lead inside of paint. So we're still doing, and offering programs to remediate that and take away that risk. Then we also have to look at other factors, businesses that may also increase the risk of lead exposure based on their operation. So it is definitely something that hasn't gone away and something that we continue to educate on and try to work towards reducing that risk.
From a lady who lives in a very old house. It's troubling. But I can see here that on ph.lacounty.gov, you also have resources to test and see if your child has been impacted by lead. But if you did find that out, what can be done about it?
Well, this is definitely something that you would be talking with a healthcare provider about, and they're typically the ones that will do lead screening. as well. And, depending on, what that level is, tell you what to do, for your child. And then, depending on what the cause was, definitely there will be a lot of education as to how to reduce that risk and get rid of what may have been the source of exposure for that child or for that adult. So lots to do there, but most of this is going to start with the healthcare provider in terms of doing that assessment and talking about any potential impacts from whatever level is found.
Wow. So, we are in a stressful time globally with what's happening in the Middle East and Ukraine, the rising prices. Now here locally, we're dealing with not just, still being in a pandemic, as you just informed us, but also one of our major freeway arteries being shut down, which stresses folks out to no end. What about managing stress? Where does that come in as far as our county health outcomes?
Well, it's definitely something that, can have an impact on both our emotional and physical well-being. And, we want people to do a number of things that actually have other health benefits, so, gathering socially with people is good in terms of releasing that stress. Having a person or people you can talk to about what's going on with you is also good in a healthy way. Doing exercise, getting out and walking. You can walk and talk, especially after a meal, is also very healthy. But stress can, cause things like depression, can increase your risk of having high blood pressure and heart attacks and things like that, depending on how bad it could be. But it definitely plays a role, and, everything in our lives, can add some stress. We just have to look for those ways that are healthy to allow us to release that.
Yeah, and I know that, there's so many programs and resources available within LA County that a lot of us don't even know about. Can you point us in a direction if if I'm feeling like I need some help to, deal with stress management or in my life?
Yeah, for a lot of people, and I would say, finding resources to deal with whatever you may be dealing with, actually calling 211 is an information line that can answer a lot of questions and point you in different directions for different things. Whether that be something related to housing, whether that be trying to find health care, or whether it be, having a need for some, mental health or emotional issue. They can, point you in the right direction. So that's probably where I would tell people to look right away,
Okay.
for help. Yeah, they're connected to a lot of resources that are available for people.
Now, explain the difference between 211 and 988.
So if I remember correctly, 988 is really mental health, potential suicide, et cetera. And 211 is general. So again, healthcare, housing, mental health as well. And so one is going to get you more directly to, resources for mental health or to deal with an emergency situation.
Mm-hmm.
That 988 is a suicide and crisis lifeline. So that is really geared more towards that. Whereas 211 is more general support and can be specific, but they have other things that they're going to connect you to as well.
Services and solutions within LA County. Are we worried about the 10 freeway in terms of, we know there were a lot of toxins under there. We know that, stuff is being cleared out by firefighters, and obviously the traffic impacts in the communities. There's an article today's LA Times about that, how folks driving through neighborhoods is adding all this, emissions locally. Are we concerned about health impacts of that disaster?
Well, I think, our traffic is our traffic, in LA, and our traffic emissions are, what they are. And they don't stay in just one place. Depending on the wind, they'll blow. So I think we probably still have the same number of people driving, if not less. Hopefully more people are using, public transportation. But we're not have anything to say that there's going to be anything more from this fire. The biggest risk is when the fire is burning itself and the smoke and everything else. But that's been contained, and so now we're just going through the cleanup and repair.
Right, which is why we get those air quality bulletins when there's a fire to stay inside. And I guess we're not supposed to go in the water right now because we've got some stuff happening with the ocean water. Like you said, it is what it is. These are not surprises. Dr. Muntu Davis, thank you so much for being with us this morning. A quick thought to leave us with?
We have a lot we do individually, and we're all connected, together, and we just have to keep that in mind as we go about our business and our days. Take care of ourselves and try to help take care of others. And for those who are, again, looking for vaccinations, I'll give you another resource. Our phone number, 833-540-0473. Again, 833-540-0473. Open 7 days a week from 8 a.m. to 8 p.m. Can answer lots of questions and get you to locations where you want to get vaccinated.
Dr. Muntu Davis, thank you so much.
Thank you.
News, traffic, sports, and then call me. KBLA Talk 1580.
1580 Santa Monica.
Good morning. I'm Mike Moore. Here's the latest from the Black Information Network. George Floyd. Chauvin